in the reproductive acupuncture community, it's been fantastic because at Conceivable, what we're really interested is finding the problems in the menstrual cycle that are the deepest problems. So, for example, if a woman only has 1 day of bleeding in her cycle, most women are very happy about that because they're like, all right, this is fantastic because I only have a day of bleeding. It's so easy when I have my period. It's no problem. But the problem is the amount of blood that a woman has during her menstrual cycle tells us how robust her constitution is. It tells us how much surplus she has the resources to produce. And so if she can only produce 1 day of bleeding, that tells us that some part of their constitution is compromised. Now, that could be from external things, like if she's a marathoner, right? Frequently you'll hear that elite athletes will stop menstruating. It's because they don't have any surplus. All the surplus energy that they're using is burned out through exercise, and there's nothing wrong with that, but that's what's happening when that happens. It could be because the diet that she's choosing to eat isn't nutrient enough. It could be the diet that she's eating just simply isn't nutrient rich enough to provide the nutrients for developing marrow and turning marrow into blood and blood into uterine lining. Sometimes it's the mechanism of digestion in itself that's the problem. So they're eating a diet that's rich in nutrients, and they're eating fresh, local, organic food, and they still aren't producing very much blood. And that tells us, something is wrong with digestion. Something is wrong, not elimination, but digestion, the mechanism by which we take food and break it down and convert it into energy and convert that energy into blood and blood into the menstrual blood. So we have to correct that. We want to understand, is that the deepest problem? Well, why is her digestion compromised? Well, is she looks like she has subclinical thyroid problems? Is she cold all the time? Remember that to convert anything into energy, we need heat. So if the woman's freezing cold all the time, she's got cold hands and feet, she's got frequent urination, then we suspect that digestion isn't the root, right? There's not enough heat that's being generated, metabolic fire being generated to catalyze the food into energy. So when we work with women, we keep drilling down deeper and deeper to try to understand what's the deepest mechanism and address that there. And we've been really educating the reproductive acupuncture community about that in a different way, and they've been really excited and receiving it really well.